to ask our friend Rupesh, whose other name is Dr. Adimulam. He's a consultant psychiatrist in North Essex Partnership University Foundation Trust since 2011. He has experience in wide range of subspecialties in psychiatry. He works as a general adult psychiatrist in North Essex Partnership Trust. He's been managing the inpatient ward, and also he runs specialist neuropsychiatric clinics in Broomfield Hospital. So he's going to talk to us today on protecting mental health of families. Over to you, Rupesh.
Thank you very much. Thank you very much for that, Palaji. We'll mute ourselves.
To unmute yourself. Rupesh, unmute yourself first. Okay.
Sorry, the technical problems. Thank you so much, Pallavi, for introducing me. So yes, I have been known to all of you as Rupesh, as a devotee of Hindu philosophy. So even though I'm not specifically attached to one particular God form, I'm attached to Hindu philosophy. You all have known me in that form. Obviously, today I'm giving a talk completely in a different role, but still my primary role as a devotee to Hindu philosophy continues to remain, because the information that I'm going to give now is going to reflect some aspects of Hindu philosophy. So the mental health is not something that has come up something new. It has always been there ever since the mankind has been in existence. We all had questions starting from the beginning. You know, every human being had a questions from the beginning about how we all came to this existence, and what will happen during our life and what will happen after that. This is nothing but the thought process. Whenever there is a thought, there is a scope for mental health. So if you take any religion, the integral part of every religion is about internal peace. The internal peace comes from not only physiological forces acting against each other, leading to a balance, and psychological factors which cannot be completely understood by human thoughts. That's where the concept of God came into existence. So the point that I'm going to make today is, yes, in every mental health, there is a spiritual component. In spiritual component, there is a mental health. So we cannot separate these two together. So we are going to start our discussion. It may take up approximately up to 30 minutes, but if you have any questions at the end, I'm more than happy to answer this. First of all, let me check with you whether if you are able to clearly hear me or not. Pallavi, are you able to hear me?
Yes, sir.
Yes, we can hear you. Yeah.
Is it clear?
Very loud and clear.
Very loud and clear. Thank you so much. So let me have this PowerPoint presentation here. So I have been disabled. Pallavi, could you be able to, if you click on the share the screen, and if you allow all the participants to share, that will allow me.
So you should be able to share now.
Okay, that's fine. So is this the one, Nilima? Which one? Yeah.
Yes, we can see it now.
Can you see it clearly? Okay. Okay, once again, thanks everyone. I think we are starting a little early. What time is it now? It is nearly 5 to 7. Of course, people who are really interested to know about it, they will come and join us. As I mentioned, my primary role as a psychiatrist, but I also developed interest in spirituality over the last 4 years. And I have become a member of a special interest spirituality group in the Royal College of Psychiatrists. What I have noted is during the process of my encounter with the patients, good number of patients often have a religious background. For a long time, religion was considered to be a negative factor in protecting the mental health. If you look back into the Freudian era, that means Victorian era, around 100 years ago, people used to believe that mental health was significantly affected by religion. but eventually 100 years later, certain aspects of every religion definitely protects mental health. Okay, so some of the views that I'm going to express here, not at all related to religion. Some of them can conflict with our own philosophy, but some of them are in line with Hindu philosophy. So especially our Indian community who are living in the UK, we have a special place. We are stuck between two cultures, the culture from India and culture from the Britain, and often we get confused. So that's why mental health is at the bottom of our priority. We rarely pay attention to it. In fact, in the back home, we hear that psychiatrists are themselves are mad people. So that's how we see it. It is because of lack of exposure and lack of understanding. Now, today we have just heard that number of cases of COVID-19 have suddenly jumped from 1500 to 3000. That has caused significant amount of unrest among so many of us, because from tomorrow onwards, schools are going to be open, children are going to be in the school, and we don't know how it is going to happen, how it is going to affect us. So that leads to a lot of fears. Whenever there is a fear, that means the things are out of our control. We call it as stress. Stress can manifest in different forms. It can be a fear, that means when there is no control, or if you have any work which is beyond your cognitive load, that means which is beyond your ability, that can become a stress. So stress can be an acute stress or a chronic stress. Over the last 6 months, initially it was an acute stress because suddenly this COVID became a threat to the mankind, and eventually the stress continues to exist. So now we have to live with the stress. It has become a chronic stress. A lot of research is coming up now in relation to COVID and how that is going to affect the children and the adults. So it has become a prime time importance for us to discuss. If you look back in olden days in temples, they used to have sessions. The discussions were not only related to spiritual angle, but was also about health. So we have actually reintroduced that concept of having discussions around our own health in this temple concept. So with that introduction, let us go into the discussion. Let me give you some facts about the mental health. Mental illness is not a single entity. Often people come and ask me, what is mental illness? It is just like any other health problems. There are so many problems. I'm not going to discuss all of them here in detail, because the main purpose of today's discussion is about to give a brief understanding of how this COVID related stress is affecting us and what we can do in order to make things better. Some of the discussions that are going to happen now, not necessarily something new. We have already been practicing. Just give a little insight into what we have been doing, what is likely to be helpful, what is like unlikely to be helpful. So 1 in 4 in the world suffer from some sort of mental health issues. It can be minor or it can be major. Depression is a major cause of disability in working age group. Mental illnesses are common among ethnic minorities because we have a special place. Completed suicides are common among Asian women. Immigration is considered as a risk factor for mental illness. 10 to 20% of children suffer from mental health issues all over the world. In developing countries, it is not that recognized. In developed countries, the problem has been recognized. Mental illnesses run within the families. So what causes mental illness? We often believe that mental illnesses are caused by some stress within the society. We attribute everything to society. We attribute either to family or some job loss or employment issues, something else. But actually, it is not related to one entity. Mental illness are related to genes, brain injury, substance misuses, malnutrition, etc., etc. There are environmental factors as well, like weather, sunlight, metals, food, etc., etc. Personality itself plays a significant role. As I mentioned, the stressors like family, society, politics, economy, wars, all these things contribute to it. especially in the Asian community, within that, in our Indian community, mental health has some misconceptions. We often see it as a sign of feeble-mindedness. We often believe that Indians have less of these problems. If you listen to any religious talks, they often bloat about our culture. They say that Indians are well protected. No, according to WHO, Indians have more mental health problems. Necessarily, they are not seen in that way. We often believe that the culture is so strong. Yes, there are so many strong factors within our culture. At the same time, there are so many negative factors. We often try to overlook them. Another misconception is this is only limited to Western society. We often hear from my Indian friends, yes, our religious preachers often say that Western countries are going towards hedonia, that means towards a pleasure. That's why they have mental health problems. This is again a myth. Yes, there is some truth in it, but it doesn't mean that it is absolutely right. People often believe that it's a business. It is more often heard from religious leaders. There is a joke. They used to say that neurotics build castles in the air, psychotics live in it, and psychiatrists collect the rent. So that means mental health is a myth, and psychiatrists are making money out of it. That is again a myth. We often believe that we are so strong, we are not going to be affected. But again, that is a myth. Mental health can be disordered at any time to at anyone. The list goes on. It's a time for us to break the silence. We have seen in the media that there has been a death of Bollywood actor Sushant Rajput. We don't know whether it was a suicide. We don't know whether it was a homicide or murder. Some of us attribute the problems to the politics in the cine field. Some argue that there are issues in the relationship. Some argue that there are some problems related to illicit drug use. So whenever there is a problem with a celebrity, people talk for a while and we forget after that. Even though we live in the UK, our mind is always in India, and hence it is a time for us to discuss now. As I already mentioned, in the survivors of the COVID-19, a lot of studies are showing that they are struggling with post-traumatic stress disorder. We know that Asian people are at higher risk, and the more deaths are reported in the blacks and Asians, that itself has increased the fears. At the same time, the cases in India are rising. That is again causing further level of stress within us. And I have noted lately that more Asians are,
I sent you some links.
I think,
I sent you some links.
Pallavi, could you please request?
And some pigs.
Okay.
Okay, sorry for the interruption.
Trying to see who it is. Okay.
Why don't you mute everyone with Pallavi?
Yeah, I'm muting.
Yeah.
Okay, so can I continue?
Yeah, continue.
Okay. So, and I have noted in my practice that more patients from Asian background are being admitted to mental illness. So admitted to hospitals with mental illness, but good number of them didn't have any history of having previous mental health problems. Let us look at philosophical level. So Lord Krishna taught Bhagavad Gita to Arjuna in the war field. He never taught it before or even after that. So Arjuna realized that that's a need, and Lord Krishna taught the Bhagavad Gita. But actually it's war field. Are we not in the war field now? We are fighting for our lives, for our children, and also for our family and friends. We don't know what's going to happen. We don't know whether we are going to survive or not. At the same time, we don't know if we get affected by COVID, what's going to happen, whether we'll have some disabilities left. And there is a lot of concerns about the safety of our children, our job, this job threat. So this is a time for us to discuss. Our condition is not much different from zebras. You see, zebras, they live in a group. They're often chased by lions. They run around and they come back and behave as if nothing is happening. And whenever the lion chases, they all run around. Our situation is more or like that. We have to live with our invisible enemy. It is next to us. We don't know what's going to happen to us. The only difference is we have ability to think, but zebras do not have. So that's the reason why we need to start focusing on it now. We have challenges as minorities. We all stay away from families. We often feel alienated. Stigma is a major problem, due to which we often delay seeking help. We are subject to subtle or overt racism. We continue to live in fears about ourselves and our families. We know that Black and ethnic minority, Asian minorities are at higher risk of death. Our jobs are in threat. Cultural factors do play a significant role. So at the time when the COVID was seriously very active in March and April, a lot of messages over the WhatsApp were in distribution. A lot of messages in relation to religion actually damaged our understanding about the COVID. For example, application of cow urine or cow dung, etc., etc. It was not very good sign at all. So religion can be helpful. At the same time, it can be dangerous. Now the question is it about only an individual or about the families? So individuals together make a family, especially if there is a breadwinner in the family. If that particular person is affected, the entire family is affected. So it's a time for us to think about the not only individual or the family. Let us look at the mental health. Let us believe that a man suffers from depression. He feels not interested in doing things. For example, at home, if the children have planned to go out, this man comes home feeling depressed without having an interest. So he postpones going out. How does wife react? Wife may think he is completely changed over the last few months and not doing anything for us, as if the love has come down. So she is likely to blame. Then the children who do not understand why father is behaving like this, they feel that their dreams have been shattered. So they react by throwing tantrums. So wife gets upset and she blames. This man who is already suffering from guilt continues to experience the feelings of worthlessness, hopelessness. Then he gets depressed. So the cycle continues. Eventually, the entire family gets affected. Children do not get any positive parenting. So they are also at higher risk of developing mental health problems in future. So it is very high time for us to think about the mental health of the entire unit as a family. As I mentioned earlier, stress often precipitates the illness. We believe that stress causes, do not necessarily cause it, it can often precipitate. We all develop defenses to manage stress in our life, but when stress becomes overwhelmed, then we are likely to experience a disorder. Okay, our experiences also influence our life. Then our life influences our experiences. So we get into that cycle frequently. There are special challenges to Indian families. Okay, yes, we often believe that we have very strong family ties, but these strong family ties can be unhelpful. Look back and reflect on how you have been over the last 6 months. We are restricted to a small rooms or small house, and that leads to significant communication breakdowns. Generation gap is a big problem. We continue to think like Indian, but our children think like British. So that leads to conflict. And especially during the lockdown time, imagine certain families, how they struggle to understand. We feel entrapped. Yes, in Western countries, the positive side is if the relationship is not going very well, people, they can get out of the relationship. But because of the strong religious and cultural factors, we feel entrapped. Yes, in one way it is positive, but another way, it doesn't help. So we know that mental illnesses run within the family. It is specifically challenging time for children. They have never seen this kind of problem before. It's a high time for the development of their brain, especially adolescents. If you take the children below the age 10, they do not necessarily understand the gravity of the problem. But children age about 10 can understand the severity of the problem to some extent. Hence, they have fear for their own life. They have been isolated for more than 6 months at their home, so they don't have a positive social inclusion. They spend a lot of time with the social media, which often spreads negative information. So then again, they have to cope with the parental behaviors. Parents themselves do struggle with fears. So they often exhibit their behavior in the form of irritability. These children who themselves are struggling to understand what is happening around, they have to cope with the parents as well. So again, it's a big challenge for them. Again, issues within the parents also affect. The relationship issues become more apparent because previously, husband or wife, they have their own working life, and they used to meet only in the evenings or in the weekends. But now they spend a lot of time together. At the same time, because they spend more time, the relationship issues become more apparent. We shouldn't forget that husband and wife, they have their own stress. Husband might be worried about his own family and financial concerns, and wife might be worried about her own family, and she might be having her own financial concerns, and how they relate to each other in relation to that. So their failure to manage the stress affects children. And again, they implement their fears on children. If you look back, how many of us took adaptive strategies? I did see people constantly washing things at home, even while doing the shopping, you know, even though there was no clear evidence, they were washing everything. So they were also restricting children more. So that doesn't help. So again, there is a change in the thinking style. Good number of us developed catastrophic thinking. That means as if the life is going to come to an end. And again, parents also fail to understand the behavior of the children. So now let us understand what is stress. Stress is very important for our functioning. When there is a little bit of stress, then we perform. That is called optimal stress. When the stress is beyond a point, we feel fatigued, we feel exhausted, then we develop anxiety or panicky or anger. Eventually we break down or we may feel burnt out. So stress can be an acute stress or a chronic stress. Often, you must have heard about something. Okay, if I put a small piece of stone in your hand, and if you have to stretch your hand for 5 minutes, you may feel that it is so light. But if you continue to hold it for a longer period, your hand feels heavy. So it is not just about the severity of the stress, chronicity of the stress that makes a difference. Now we are in the chronic stage of the stress. So let us look at some of the behaviors that happen during the acute stage. Let us look back. When we really first time we heard about this virus, we all felt shocked. We didn't know what to do. Some of us behaved as if there was no problem. We often dissociated from the problem. That means we were just working our just we were doing things mechanically. When it becomes chronic, people develop irritability. We often feel fatigue. We experience pains all over the body. Sleep gets disturbed. We experience fluctuations in our mood. We also struggle with concentration difficulties. This further affects memory. People develop anxiety, and sometimes it may lead to severe mental disorders. All of us, if you look back, we definitely experienced one or two symptoms. Okay. So let us look at our ability to manage stress, how this comes from. Let us early experiences shape our beliefs. Our beliefs lead to automatic thoughts, and that affects our behavior. Let me give an example. If a child is called as an idiot by his dad, that is an early life experience. Okay. Then That boy goes and gives exam, and he may not be able to understand it clearly. When he's not understanding it clearly, that thought comes to his mind. His dad called him idiot. So, okay, I might be an idiot. That's why I'm not able to understand it. So then he stops doing it. Then he will fail in the exam. Then he'll feel that he's an idiot. Okay. Eventually, let us assume that that child is grown up and got married and got into relationship with his wife. And there is a situation. His wife might give him some kind of a task which he might not be able to do it. Then automatically thought comes to his mind that he's an idiot. Then he responds to his wife in an angry manner. That leads to make his wife maybe angry. Then she might call him, you're an idiot because you are not able to deal with the problem properly. That will make his belief so strong. So what we are today is because of what we have been all these years. That will influence how we deal with the stress. I hope you all got the point. So let us see the long-term effects of the stress. If the stress continues, we often experience interpersonal difficulties. Let us focus on our children. If the children are exposed to this stress for a long time, and if the stress is not properly managed, they experience interpersonal difficulties. That means they struggle with the relationships and also in the employment. Yes, that increases the risk of obesity. Good number of children get into substance misuse or alcohol or drug use. In severe cases, they develop post-traumatic stress disorder. It's almost like a trauma now. They develop nightmares, feeling detached, flashbacks. Good number of people develop health anxiety. For simple reasons, they focus on their health a lot. They consult the doctors more often than required. So their life revolves around health all the time. You can imagine how it's going to affect their productivity in future. Good number of children also develop personality disorders, which is a completely different entity. I don't think we need to discuss. If you want, I can explain what it is later on. Let us try to understand from this karma point of view. Okay, I told you already, our early experience shape our personality. Okay, similarly, in our karma theory, we can't sometimes explain what it is. Then we say that, okay, there was some problem in the previous birth. We don't know whether it's a previous birth or not, but our genes come with some information. So genes can dictate our behavior to some extent. For example, impulsivity. If I'm a kind of a person, make decisions impulsively without thinking about the consequences, there is some genetic reason behind it. So that we can call it as vasanas. Our experience of parenting, that can be a samskara. So already genetically I am predisposed and I am exposed to negative parenting. That negative parenting is again due to that parent's previous experiences from his own family or from the early childhood. That affects our thoughts. That is nothing but our buddhi. Then that affects our ability to analyze the life. So based on our analysis, we react in one particular way that is called behavior, otherwise called karma. So our behavior has some consequences. That is again karma. That means we are adding. The way our thoughts become more and more intense, we also add karma. That is called sanchita karma. So we get into a loop. It's what we call as a janana marana chakra, but in psychiatric language, we can call it behavior and thoughts loop. We behave in one particular way that influences our experience, that experiences influence our thoughts influence our behavior. So in our philosophy, they mentioned the appropriate measures to break this cycle that is nothing but dharma. So let us try to understand what we can do to make our mental health more protected. Some of them are called maladaptive defenses. That means what we do is unlikely to be helpful. We react in two ways. The first one is defense. That means we don't know that we are exactly doing in that way. The second one is called coping. Coping means we consciously think and plan to cope with the problem. The first defense is denial. We behave as if nothing has happened. We don't feel anything. Some of us rationalize. So rationalization, we, for example, let us say we talk about this Gomutra thing. Okay, we know that that is not required, but people who seriously do that, they have their own explanation. They try to give a scientific explanation behind it. So that doesn't help. Some people try to be too intellectual. Let us look back and see when initially we all knew about this COVID problem. Everyone tried to be a scientist. We all wanted to forward the information. We all wanted to know too much about this virus. But actually, how many of us really understood what the problem was? That is intellectualization. Projection, we blame others. For example, if you go back to India, people blamed Muslim community for spreading this illness. At world level, we blamed Chinese. Some people blamed America. So that continues. So we blame everything. It doesn't help. Displacement. So that means we show our unhappiness or irritability on someone else. Usually, children are the one who are affected by it. So maladaptive coping. We often give up learned activities. If you look back, how many of us really continued our learned activities? We often feel isolated. So we isolate ourselves. Yes, sometimes more than required. Good number of us became superstitious. Yes, religion is very important. If you look back, we unnecessarily took some superstitions. I already mentioned about overprotective behavior. For everything we try to think in a catastrophic manner. We become argumentative. Yes, we want to put our thought forward. You must have seen in the WhatsApp groups how many times people got into arguments about it. We become over involved. Everything is about that. Everything is about that. Okay. So what is going to be helpful? Adaptive defenses, humor. Yes, a lot of jokes were there on WhatsApp, which was the right thing to do. And some people developed a good thing, good hobbies like art. A lot of people did some creative activities. That was good. People made short films. I think in the South Enders, ladies joined together and they made some videos and they shared. That cheered them up. Altruism, charity. So nothing can replace it. Even in our scriptures, they talk about yajna. Anything that you do for the collective benefit, it is called yajna. That was helpful. So now if you look back, we really, good number of us took this on board. Adaptive coping, spending time with the family, not giving up the activities at all. So we know that idle man's brain is devil's workshop. The moment you stop doing things, your brain is occupied by negative thoughts. Okay, so better not to give up any activities. You can explore new ideas to ways to cope with the change. Change is inevitable, especially the friends coming from software background. You must have given some training about understanding or managing the new life. Focus on pleasure activities more. Be creative. Try to learn new things. For example, in my case, I started writing some stories which have been published lately, and my wife developed interest in gardening, which has been very helpful. Spirituality has a significant role. We need to be very careful. Religion is different from spirituality, and there is a strong evidence that spirituality helps. For example, our Chelmsford Temple Force has created this Zoom puja. We all have come here. We share our feelings. We try to understand each other. We support each other. In that way, it has helped. And we also try to understand our own self. Now, let me give a very a loop, what we call thought, behavior, and emotion. For example, if you come home feeling worried about what's going to happen to your job, that affects your emotion. You feel sad. When you feel sad, you avoid household activities. When you stop doing household activities, these thoughts come to your mind again. That makes you feel sad. So we get struck into this behavior. This is called cognitive behavior model. We need to break this. Better not to get into that. Okay, let us try to link that to our Gita. You must have heard about mindfulness. This is a multi-million business now. Actually, it has roots in our scriptures, especially it comes from Buddhism Of course, Buddhism is a part of Hinduism. It is there also in Gita. It's about existential living. Otherwise, we call it as a karma yoga. What is existential living? Either we live in the past or we live in the future. We often blame ourselves for not doing many things in the past, or we worry about the future. At this current point in time, how many of us really feel this moment? Okay. Even when we join here for the Zoom puja, I keep observing good number of us, either we look at the mobiles. Yes, we are physically present. We are not enjoying the puja, but we are looking at our mobiles. Whenever we hear the bell ringing, then we take the arati, then we become busy with our mobiles. Can that be called existential living? So otherwise we call observing things as a sakshi. So being aware of what is happening around us constantly, that is called existential living. Yes, we can do a session about mindfulness, how we can train ourselves. Use your buddhi as viveka, because Lord Krishna says all our five senses give us inputs to our mind. So our mind start getting into various directions. Use your buddhi is nothing but our thoughts. Use your thoughts to differentiate what is a positive thought and what is a negative thought. And we can have a session about that as well. And you doing yoga asanas, of course, asanas help with your fitness. Your fitness releases hormones called endorphins. They make you feel good. Of course, meditation is very helpful, but you need to have a regular practice. So I haven't mentioned anything about any medication. These are all the general tips. We all have been practicing it, but we need to know how helpful they are. Okay. Yes, I didn't mention anything about diet. Yes, it is there in Bhagavad Gita. How diet can be helpful, and having a discipline about your own diet will help you. What we shouldn't forget is we are not alone. Yes, we are all mingling here. That's one aspect, but good number of us may have financial problems or problems related to tax, etc. We don't know whom to approach. There is an organization called Citizen Advice Bureau. You can approach. There is a mental health charity called Rethink. You can seek support from it. Yes, some of us who necessarily not in this meeting now may have suffered some losses of the family members. They don't have time to mourn, because previously when family members died, people used to meet and they used to collectively mourn. But now we don't have that choice. We are stuck. So there is no scope for mourning. So that's why our bereavement is not properly processed. We don't go through the phases. So that's why there is an organization called Cruise. This can help offer the bereavement counseling. Our children who are adolescents, schools are being opened, drugs are around. Yes, sometimes I get calls from parents from Asian background to seek help. It means our children are not immune to not experimenting drugs. So if they have any problem, young persons drug agency, that service will help. We call it IPIDAS. Samaritans, for example, if I have any problem, if I talk to my friend may not be non-judgmental, because my friend might think from his angle and give me advice. So I may not be happy to come forward and discuss with my friend. So we need to have someone to talk to us. Samaritans are likely to be helpful. You can give them a call. Their number is there on the Google if you really want. Yes, community supports like Chumps for Temple Force, our Southern Ramnami group, ISKCON, it helps. Yes, we have Chumps for Samvaral group. Yes, we're all here to support one another. But you need to be very careful when it comes to religion. Religion is a double-edged sword. It does not necessarily give you the right direction. So you have to use your buddhi or viveka and find out what is helpful, what is unhelpful. Now, let me thank you all for patiently listening to me, but I'm more than happy to take any questions.
Dr. Rupesh, this is Debalina here. Just wanted to very thorough and very detailed presentation. Thank you for that. I think one of the things, so I work in the NHS, and one of the things that I've come across through friends and family is a lot to do with teenage and adolescent eating disorders. And that sometimes gets heightened in such circumstances as we are all going through now. And I wondered whether there is any kind of advice from yourself as a clinician for us as parents and professionals about the best ways to deal with it, apart from the standard referral routes through primary care or through secondary care. Are there any specific things for eating disorders, for children with eating disorders and their families?
Yes, if there is a clear-cut definition of eating disorder, if the child meets the criteria for eating disorder, specialists teams involvement is mandatory. Yeah, because if we call it as an eating disorder, which meets the criteria to call it for, let us say, anorexia nervosa or bulimia. These are the two major categories. I think other people who do not know what exactly it is, let me briefly explain. Anorexia is a condition, especially it is common among adolescent girls compared to boys. They are preoccupied with their body weight. Even though they appear quite slim, still they continue to believe that they are overweight. So they try to restrict their weight. In order to achieve that, they try to control their own food. So even though everyone knows that their weight is dropping to a dangerous level, they continue to believe that they are overweight. So this is a very dangerous condition. The second one is called bulimia. That means the weight is not necessarily a significant problem, but it is a problem to some extent. What they do is they end up in binge eating. So they eat too much and then they regret of what they have done and they induce vomiting or they use laxatives. They do exercise. Okay. So that can be called bulimia. So, sorry, between bulimia and anorexia, anorexia is a serious problem. So it has to be dealt by the professionals only. The reason is the children who exhibit anorexia kind of a behavior, they also have additional problems, especially perfectionistic traits in their personality. This anorexia, as you rightly mentioned, it becomes more intense during the stressful time because this is the time we would like to achieve some control. Let us look back. We are, all of us, during the stressful times, we revert back to some safety behaviors. Okay, these safety behaviors are the one on which we have some control. So children who feel that they don't have control over anything else, the only thing that they can control is the diet. So they try to control their diet. So during this process, yes, the existing eating disorders they do get worse. But as a parent, I would suggest to have only non-judgmental approach, because as a parent, we would like to have some control over it because we are worried about their future. Especially our Asian families, we like to, or we would like to dictate their future. I'm not saying that every family, but culturally we are driven. That is something different compared to the local counter population. So it is very hard as a parent to witness the child struggling. So we try to step in, we control. So what is happening? We are actually making the child to control more. Okay, because if I try to use control more over my child learns to control. That means it becomes more, they try to become more perfectionistic. In our mind, we think we are helping, but actually we are not helping the child. Child perceive it as a control. It gets worse. So what we need to give, let us go back the basics. When the child is a child, tender love and care. That is not, that is, there is nothing that can replace that. Okay, put aside everything. Let us not to think about future. Let us not to think about the past. At this point in time, as I said, existential living, mindfulness. Yes, the child is struggling. We need to empathize. Yeah, for example, if the child is struggling, we often give an advice. Oh, I think you're thinking too much. Please take it easy. Okay. Let me try to give from my own reflection. When I was preparing for my exams in my childhood, especially when I was preparing for medical entrance, I found it very stressful. I told my mom, it's very stressful. I don't think I'm going to get a seat in medical school. You know what my mom said? Oh, you're capable of doing things. I think you are thinking too much. Take it easy. I used to feel angry because in my mind, I felt it was too much for me. I felt that my mom was not able to acknowledge the struggle that I'm undergoing. Everyone was minimizing, but from my mom's point of view, she was trying to reassure. I think that's where we struggle. So we have to validate the child's struggle. We often don't have empathy towards the children. Okay, so when they're struggling, not to make any kind of a judgmental comment, just empathize with them and be supportive. That's the basic step as a parent to take. The second thing is there is a difference between the parental attitudes. Okay, father may have a view, mother may have a completely different view. So mother gives one instruction, father gives a different instruction, that confuses the child. So it is very important both father and mother stay together, remain as a unit, and have a unified approach. And they shouldn't forget that they should have empathy first, tender love and care. That's what is important. And yes, I would say better not to discuss much with friends and families about this, because they all have in one particular way, a way of thinking. They try to put their own thought forward. It doesn't help. So better to discuss with the professionals. Usually if the children have this particular problem, if they are known to mental health services, usually they have a care coordinator. Listen to the care coordinator or the consultant psychiatrist involved rather than listening to anyone else. But as a family, when you are stuck within that, now I know that mental health services are really struggling. They are not able to offer the support the way they used to before. But within the limitations, what you could do as a family is empathy, unified approach, tender love and care. Does it make any sense?
Yes, absolutely. Thank you so much. I just wanted to reiterate a couple more things, is that every local NHS, every local CCG have got their own resources that we commission for children and young people. And some of them are some online resources as well. You've touched upon a few already. So Koot is something which is very useful for children to have access to. At the same time, I would also like to reiterate that in places like across Essex, in places like Southend, Thurrock, and also coming into Mid-Essex CCG, there are interventions that are going to be introduced in the schools in the form of mental health support teams, so that the school pastoral care has direct input and referral routes, and that specialized input comes in at an earlier stage. So more of a proactive way, as soon as the school gets to notice something, or if the family is involved, notify the schools about any issues developing within the child. So it's more of a holistic, it's more of a joined up approach across all agencies concerned. So that is also being introduced. And we would see the benefits of it. So we are in the training process at the moment, and we would be seeing the benefits of it in the next couple of years. And let's not forget that your GP is your first point of contact. And if you're not getting services that you think that you need the referral to, then you can always escalate through the latest thing that has been introduced is the 111 service. And if you press 2, you get direct access to mental health services, whether it is children's or adults, and you would be, forwarded to the right point of help. So let's not forget all of that as well. So I just wanted to reiterate that. Good. As, being with the professional hat on.
That's good. So can I understand what your professional role is?
So I'm a senior transformation and commissioning manager at Mid-Essex CCG.
That's good.
And I am also the lead for children and young people's mental health, as well as the lead for dementia. So I come across the mental health aspects of both older people's as well as children's on an everyday basis.
Okay, that's good. That's really nice to know that. Okay, good. Any doubts about mental health? But if you don't feel confident, you can always send a private message.
Yeah, thank you, Rupesh. Nice presentation as always. Is it better to be open-minded towards the religion, or better to follow the religion? Many of us always have the doubt.
Okay, so what do you mean by open mind? What do you mean by following? Just can I clarify a little bit if you don't mind?
Just non-religious.
Yes, there are so many people in the world who do not have any religious beliefs. Religion is only one form of belief. Okay, so let us say each person is an individual. Some patients who have strong religious beliefs also have positive outcome overall. Okay, let me say, if a patient is suffering from depression, if that person also has some religious support or religious views, that person is likely to have a positive mental health. What we call it is externalizing the problem. Okay, in depression, people suffer from guilt. The guilt comes from that I am not able to do it, I am useful, I am worthless. So that means when you take the whole responsibility for all your actions, in our karma we call it as kartrutva bhavana. So that means you take responsibility and you end up in blaming yourself. But our Raj Krishna ji often says Krishnarpanamastu. That means you attribute all your actions, all the effects of your actions and ownership over your problems to some external figure. It could be God. Then you obviously get a kind of liberation or release from the stress that you're already undergoing. So in that way, people who have religious views, they are likely to have positive outcome from mental illness. At the same time, it can work other way also. Okay, I have seen patients who strongly believe in religion developed guilt. For example, I saw a patient. So according to Bible, suicide is a sin. She tried to commit suicide because she was feeling depressed. So then, because she already tried to commit suicide, she started feeling more depressed because according to her, she committed a sin and God is going to punish her. So she started feeling more depressed. She wanted to take her life. So the religion can go in both in a positive and negative direction. Again, as I said to you, we have to use our buddhi. I'm talking about only prevention. I'm not talking about treatments here.
Yeah,
Does it
thank
answer
you.
your question?
Yeah. Good, thank you.
Rupesh, there is another question on the chat from Vaishnav. He's asking, Uncle, why has mental health been downplayed so much in Asian communities?
Yes, it's a very, very good question. In Asian communities, traditionally, our Asian communities have been driven by religion. Okay, if you compare with Europe, in Europe, 300 to 400 years ago, Renaissance came into existence. That means the scientific approach became more and more prominent. So religion gradually started losing its role in the human life. So that's why the focus shifted from religion to the humanity. The people are able to accept that yes, there is a mental health problem, we will accept it. But in Asian communities, as we are still driven by religion, religion dictates what you are supposed to do rather than giving a choice. I'm not saying that every religion is same. Even within our Hindu philosophy or Hindu community, there is a strong component of religion. We are all dictated to behave in one particular way. Unless you understand why we are doing in that particular way, you become mechanical. And religion also sees mental illness as a sign of feeble-mindedness, or it's an effect of your bad things that you did in the past. Yes, there is some truth in it. For example, what I am today is what I have been all these years. But sometimes you may not be able to explain why you are unhappy, why there has been a lot of problems in your life. Then people say it is the effect of your past life. You have done something bad in the past. That's why you are like this. So people do not necessarily come forward. So they try to keep it to themselves. Okay. And culturally also, people do not understand it because education levels have not gone to that extent. I don't know whether you heard about a condition called postnatal depression. I will explain to you because you have come to an age where you can understand all this. If a mother gives birth to a child, what is expected as a mother? The mother is expected to give love to the child. If the mother is feeling depressed, mother feels detached, then mother is not in a position to give love to the baby. How would people see it? Because this mother is behaving against the standard or against the norms of the society, then they are likely to respond with words like, have you been possessed by devil? Okay, or what sort of bad person you are. So rather than understanding that person as a person, rather than understanding the person's feeling, we struggle to understand psychologically. So that's why people do not necessarily come forward. Okay, so this is one of the aspects. That's why it is downplayed. People try to not to come forward. And again, culturally, when these kind of things happen, Asian communities often believe that there has been some curse or some evil spirits are acting on you. So they go to different routes. They don't understand it as a mental health problem. Some people believe that the person is possessed by a devil. They go to a witch doctor, or they go to a temple. They do some puja, this kind of a puja. When all these things fail, when things are beyond the control, then they go to a doctor. So it is fundamentally impact of the religion, lack of exposure, lack of understanding, and lack of education. Yes, even though most of us, including myself, are living in the UK, we were all brought up in India. So we are carrying our experiences. As I mentioned earlier on, we carry our experiences. These experiences also shape our way of looking at life. It is quite hard for us to unlearn what we have learned so far and learn new things. That's why even though we are physically present in the UK, our minds are in India. So me being a parent, I try to put my own thoughts or try to inculcate my own thoughts into my children. They are likely to experience that because they are exposed to my thought process. Then they also become like that to some extent. So it happens in generations. Does it answer your question to some extent? Yes, I can give a lengthy lecture, but just I wanted to make it as simple as possible to you. If you have any question, you can further write.
I don't know. I think you answered it quite well, Rupesh. You know, it is perhaps partly our culture, partly our ignorance, and probably driven by our previous life experiences that causes it. There is another question from Shashiraj, sir. Are you online, sir?
Shashiraj Garu?
Yes, Sandy.
Okay, sir.
Hi, Andy. Thank you, Pallavi garu. So one question, yes, whatever you have just mentioned, I have personally faced it, like detachment and concerned about grandparents and parents. So after facing all these things, I mean, in my family, my grandma, she was infected with COVID, and she's been treated now. She's fine back home in Hyderabad. But apart from that, the other thing that what I have noticed is because of this change in our lifestyle with these lockdowns and all, I have slightly detached from the regular activities that I have been doing, and I have developed interest in singing, but that has become like an addiction now. I am on an app called uh, uh, Star Maker or something. So it has become such a big addiction now. I don't know, is that something side effect of this kind of stress or something, or?
Yes. Um, when there is a stress, are you able to hear me?
Yeah,
Yeah.
I'm able to hear you.
Okay. When there is a stress, as I mentioned earlier on, we develop certain coping mechanisms. So some of the coping mechanisms we call maladaptive coping mechanisms. Okay. So in this
Yeah.
So adaptive ones are not giving up what you have been already doing. So you mentioned that you have given up some of things that you have been doing, not given up some of things
Yeah.
you have been doing.
Yeah.
You developed an interest. But what you, because you try to use it as a coping mechanism, overdoing, I said over involvement. Okay. I think if you go back to the slide, I said over involved. You got too over involved into that. We believe that because it is giving you a relief, you
Yeah.
are investing a lot of your emotions into it. So it comes to a stage where you're relying more on it. Okay. It's a part of a response to the stress. If Neelama, if you can share the screen, I'll show you where I
Yeah.
mentioned
Okay.
the word over involved. So anything, it's almost, I wouldn't say it is an addiction, but it is over involvement.
Okay.
Okay, so because you have mentioned this word, I also would like to use this time to explain about addiction as well. I'm not saying that people are staying here are having this problem, but good number of people during this stressful time use alcohol and drugs as a coping mechanism because that gives them a pleasure. But what alcohol does is it makes the brain tuned to experience the ill effects of alcohol. So that means brain needs certain levels of alcohol in the body. So for a period of time, they require more and more alcohol and they eventually get addicted. That means if they don't use alcohol, their nerves become so shaky, they feel sweats, they feel very anxious. So in such certain situations, they also develop seizures that we call what we call fits. So in order to not experience that, they take alcohol. So they get into that cycle. The liver gets damaged and the further problems come up. So what you are experiencing now is not an addiction. It is over involvement. So you need to get back to the adaptive coping, adaptive defenses, adaptive coping.
Yeah.
Yes. Yes. Spend time with the family, explore new ideas, which you have done, but not giving up the activities. When you give up the activities, that place is occupied by something which is over involvement. Yeah, over
Correct.
involvement. Yeah.
Okay. Okay. Thank you. And one more thing I would request you: is it possible to? I've seen that you're recording this session. Is it possible to just share that with whoever requests this session
Yeah, I don't think it's not at all possible. I think we should be able to do that.
on an
I-
email or something?
Yeah,
Yeah.
if it is of any particular help to anyone, I think we should be able to do that.
Okay. Thank you. Thank you,
Yeah.
Rupesh garu. Thanks so
Thanks,
much.
Ashikar. I think he raised a very good question.
Thank you.
Yeah, I think in one of the thoughts I have is in future, I think probably I should do a half-an-hour session of mindfulness training and also a relaxation training in 2 sessions, just half an hour each, which
That will
can
be
help
really
us.
good. Yeah.
Yeah, that can help. These are the basic tips. They are nothing, they didn't come from somewhere else. These roots are actually from our scriptures. The mindfulness, relaxation comes from pranayama, but it has been modified a little bit into modern practice. This mindfulness technique comes from our uh, karma yoga. That means we observe as a sakshi, as an eyewitness. How many times really we experience our finger? How many times we really experience our heart? How many times really focus on our breathing? While eating food also, do we really experience every moment? Either you may end up in talking to someone else or you may use the phone, but do we really enjoy the taste of the food every minute? We don't do that. Okay, that is called mindfulness, trying to be living in the present moment. I think just as little training is sufficient, just half an hour of training is sufficient. More we practice, more we can protect our mental health.
Please do, Andy. Please do.
Yeah, we
That
will
will
do
be
that.
very good. Yeah. Thank you.
It's not a question. I think Debalina ji wants to add something in reply to Vaishnav's question.
Please do.
What,
Yeah, if you can, yeah. Double energy, if you want to add anything, please do.
Yeah, just a comment really. I mean, I think what you how you responded to Vaishnav's question was absolutely 100% spot on. The other thing I sometimes feel, me being as a parent as well as with my professional hat on and speaking to other
Stop
friends
sharing.
and families who have such, have had similar issues, etc. It's to do with, the lack of our understanding and acceptance of the fact that, hey, our children are growing up, they're growing up in a different environment, they can have their own mindsets, they have the right to choose, and giving them that space and that time, and for them to develop their own mindsets is something I often see some of my friends and family struggling with. And I don't want to generalize this. And sometimes I face that myself in bringing up my two daughters as well, and then because possibly I know a little bit more about what coping strategies can be, what we need to do as part of our education and learning. I sometimes feel that there is a little bit of ignorance amongst us as well, which you touched upon as well. So it's more of a comment rather than, and I think we just need to be aware of that, all of us as parents.
Yes, that's where what we call it as a mindfulness. Okay, so the moment the moment you have access to your own thoughts, I mentioned about earlier on, of course, because of the lack of time, and also I didn't want to make it too technical. I mentioned about automatic thoughts. Okay, so the automatic thought means we develop core beliefs. Okay, I should be like this. If I am not perfect, that means I'm useless. If that is the core belief I have, then if I see my child as not according to the expectations in my mind, then the first thought comes to my mind is to which I don't have access. If not perfect, it's not my thing. So then we try to make it perfect. So what we call it as is these behaviors and thoughts to which we don't have access. That's where the mindfulness is coming into picture. Being mindful, being aware of what is happening in your thought process. That is important. Once you know what exactly what you are going through in your mind, then you'll be able to question your own self. But questioning itself is difficult because the moment you start questioning, that is going to open the bag of worms. Okay, so when it is too difficult for us, we push it behind. Okay, let me give an example. If a friend has given you some clothes, new clothes, but you don't like them, okay, but if a friend has given, you can't throw them, so you are subject to guilt. So you don't like the clothes, but you can't throw them. What would you do? You put them in your wardrobe and you push them inside, you close it. Because you did not arrange it properly inside, from time to time, these clothes come out and that remind you, oh, you become very unhappy to see that, and you push it back and they keep coming. So that means our thoughts are like the clothes which have accumulated over a period of time in our childhood, and we don't like these thoughts. That's why we push them back. They are in the unconscious level. We don't know that they exist. But from time to time, they come to the surface, then we find it extremely difficult to cope with these thoughts. That's why we push them back. That's where they use the word dissociation, denial. So we don't want to experience it. We don't want to feel it. Okay. So I'm sure all of us at some point in our life experienced some sort of bereavement. Okay. When those kind of things happen, how did we react? If we knew that it happened, but in the first few minutes or few hours, we believe as if it has not happened. We can't trust it. But if it goes on for a long time, that's a natural denial is a natural thing. But if it goes on for a long time, that becomes a problem. Yes, we all carry that. The main problem is we are not aware of what we need and what we want. We just inculcate, we just react. Let us say how many times we really think about brushing. While brushing, how many times you really think, okay, I have to put my brush into my mouth in this direction, in that direction. It happens automatically because all this learning is unconscious. Very few times we consciously think and make a decision. That also happens with our parenting. When it comes to parenting, we just do it and we don't know. That's where the denial and dissociation. Dissociation means we react as if nothing has happened. Just we mechanically do it. So this all comes from our childhood experiences.
Thank you, Rupesh. I think this was an excellent session today. I don't know if there are any more questions, but the feedback that's coming through the group chat is excellent. And Rashmi Ji is thanking you for offering to conduct the mindfulness session as well. I think we could have one of those sessions during our puja in the near future. So this, I think this thought from Raj Krishna ji and Murali ji to have a session on mental health as an add-on to our weekly puja has been very well received. I think this adds a new dimension to the services that's offered through this satsang, as well as joining together in spiritual services. We are also joining each other in supporting each other. Once again, thank you very much for this informative session.
Okay, thank you, Pallavi. Thanks everyone, especially Raj Krishna ji, Murali ji, and Shashigaru. So you have been actually the foundation for this particular satsang, and because of you, we and Pallavi have joined together, and we have been successfully running this. As Pallavi mentioned, it is very important for us to support one another. I'm sure there will be few more sessions that might be conducted with the help of our doctor colleagues. It should not necessarily be a health related issue. Anything which is going to be helpful for the rest of the community, I think we should take it forward. Especially conducting these kind of things on Zoom is relatively easier, rather than having a community hall. I think we should use this opportunity to support one another as a community and grow together and develop higher level of spiritual advances. Thank you.
Thank you, Rupesh.
Thank you.
Thank you,
Thank you
Rupesh
so
garu.
much, Rupesh Garu.
Thank you, Shashigaru.
Thank you, sir. Excellent presentation. Thank you very much.
Thanks, Krishna garu. Thank you. Thanks, everyone. Thanks, Rashmiji.
Thank you,
for being.
Rupesh garu. Chala bagundi. Chala
Okay.
bagundi. Thank you.
I hope it helped everyone. Thank you.
It did help. It was a brilliant presentation. Thank you very much.
Yeah.
It did
So,
help, very apt, Rupesh garu. It's very nice. Thank you. Thanks for your time. Thanks for your effort. In fact, I'm talking on behalf of Murli. We haven't done nothing, but it's all your effort and your time and your presentation. So it's very good. And we appreciate your support all the time. Thank you so much. That means a lot. Thank you.
thank you. I think we are all contributing in our own way. So sometimes we contribute our time, sometimes we contribute something else. But we all do together. I think we shouldn't forget the meaning of yajna. That means anything that we do for the collective benefit is yajna. So we are all doing different forms of yajna. Thanks.
I think in organization that we did call satsang, which you named this term satsang. Satsang says it all, that we come together and then we move forward in our life, and that satsang this is what it's all about. And thank you very much. It's absolutely wonderful.
Okay, thank you. Thanks, everyone. I think it's a time for our Nitya Karmas as usual. This is my stock word. So,
I think I've learned a new word today. It is adaptive. Indulge in new activities, but don't forget your regular activities.
yes, that is the key point. Yes. Yeah.
Adaptive coping.
Yes.
And adding one more flower or everything is in the soul. As you said, it's a yagya, but it's all great effort by everyone, and especially you and Pallavi and Raj Krishna ji. Thanks,
Yeah.
Rupesh.
Yeah, thank you, Vikas ji,
Welcome,
for being
Rupesh.
with us. Yeah, thank you.
Hey Rupesh, thank you very much, and Pallavi also, very well done.
Oh,
Very
Shamgar, okay, I didn't see you so far. Okay, I think we haven't caught up. Thank you so much.
yeah.
As I was talking, as Rupesh was saying, as part of these community activities, maybe we should have a session on finance next.
Yes.
Yes. Anything that is
Really
Well
important.
said.
I think
Pallavi.
actually it is a part of mental health, because mental health is not just about medication or talking. So
Absolutely.
what I said to you, multifactorial, whatever that happens has an influence on us. Yes, it's a part of that. So who is going to give that session for us?
No, we will not put anyone on the spot now. We'll
Yeah.
hopefully we'll have volunteers. If not, we can announce in the group.
Yeah. Okay, that's fine.
Pallavi, I want to take this opportunity. Thank you for actually including me in this group and into the groups, whatever you have done. You've done a wonderful job for me. Thank you very much.
Yeah. So double energy, I think has she left?
No, she's there.
She's there.
I'm
Okay.
still there.
Yes, very good to see you part of this meeting. actually added very important points, and you have given us hope about how to approach towards mental health, especially within this current system in the NHS. Thank you so much.
Thank you so much. I think along with finance, what would really benefit is, I'm sure there are experts over here or in the Temple Force group. A social work and finance combined session would be really, really beneficial in terms of housing benefits, you know, what happens in terms of if you're having issues with the landlord, what happens if you've suddenly lost your job, you know, and all of those kind of things, because these are the things that we hear from our GP colleagues, that they are inundated with these kind of questions from patients, and they don't have a place to refer these patients on to. And a joint session like that would be really, really beneficial.
Yeah.
So something for Shashi and Raj Krishna ji and Murli to think about, that who could be the person who might be able to bring all of those together.
I think it's
I think so we can. I think so we can. We
Yeah, I
can
think,
put it in like an episode or something. We just put all in
yeah.
terms and
Yeah.
visual.
Yeah, I
And
think
a session on physiotherapy would be grand, especially for people who are working from home.
Yep.
Pain management, mental health.
Yes, everything, whatever we do, it is likely to have positive impact on mental health.
Absolutely.
Good financing, because the finances affect our mental health. Our physical activity affects our mental health. Touch anything that affects our mental health. There is nothing that cannot affect our mental health. So whatever we do for our positive health, positive mental health, better the mental health, better the spiritual growth. So
absolutely.
So the fundamental thing is getting our mental health right so that we can grow spiritually together. Thank you, Double Energy, for being part of this group.
Thank you so much.
Yes, you added a lot.
Thank you, Dabelina. We definitely
Thank you.
we need some inputs and help from you on further sessions. We will reach you soon. Thank you.
Definitely. Thank you so much.
All right, I think Pallavi, if you could end at any time. If anything else, anyone else want to contribute to anything?
Thank you, Raj Krishna ji, once again for the puja, beautiful alankara.
Yeah, thank you very much. You're welcome. Yeah. Thank you very much.
Thank you.
And asking
Thank
Rupesh.
you, special thanks to you, Pallavi, today.
Yeah.
Thank you.
Thank you
Yes,
very
of
much.
course. Pallavi has been the backbone of whatever we have been doing. Definitely.
But,
Yes, you can manage, everything, all these programs, especially cultural programs and everything, you do it quite harmoniously and you synchronize it quite well. Yes, that's why I use the word backbone, playing a pivotal
but
role.
Rupesh, a small correction. It was your suggestion that we decided to do this program, because without your suggestion, I don't think so we would have made an effort to start this. And thank you very much for suggesting it in the first place. I really appreciate that.
Yes, we're doing together. Thank you so much. Right.
I'll just read out a quote from Krishna ji. So he says, coming together is a beginning, keeping together is progress, working together is success. With that, Hari Om everyone. See you all tomorrow. Tomorrow it's a Ishvara Puja, Shiva Puja, isn't it, Raj Krishna ji?
Yeah, it's a Mahakaleshwar Puja again. And please come and join, and we celebrate this famous Mahakaleshwar Puja that we've been doing it quite popularly.
Okay. Thank you, everyone.
Thank you. Thank you very much, Panditji. Thank you very much.
Thank you. Krishna garu, nice quote, Andy. Thank you so much.
Very, very nice quote, actually. Yes.
Yeah.
Thank you, Shashi garu. You're bold enough to, bring a personal problem into the public, and that actually helps many people to come forward and overcome their fears.
No, thanks, Andy. Thanks.
That's good. Thank you.